My name is Dr. Fred Arnold. I'm the doctor and owner of Scottsdale Pain Rehabilitation and Wellness located in Scottsdale, Arizona. I'm here today to talk to you briefly about treating the shoulder. There are a number of different shoulder conditions that we treat at our office. The solution that we use when we treat the variety of different conditions involving the shoulder is a mixture of dextrose, lidocaine, and B12. This mixture is injected precisely at different parts of the shoulder, involving many of the rotator cuff tendons, the subscapularis, the supraspinatus, the infraspinitis, and the teres minor. The AC joint, the acromioclavicular joint, is very commonly treated along with interarticular injections to help rebuild cartilage that becomes injured. What I'm going to show you is some of the more common areas that are treated on a shoulder for an actual person. We have a number of different points here that are used in the treatment for tendons, ligaments, and cartilage that are involved with a painful shoulder. These conditions treat the rotator cuff, involving many times the supraspinatus tendon, the acromioclavicular joint, the anterior and posterior glenohumeral joints. Many times patients are surprised when they find out that there is more than one injection, and this is completely different than a steroid shot. When you come to our office, I personally meet with you and we will perform a detailed history involving your painful shoulder, a palpation, exam. I will, with orthopedic tests, to determine the nature of your problem. If you do have any x-rays or MRI reports, please bring those with you so that can be reviewed during this session. We are here to help you with your painful shoulder. We treat many shoulders and we try to reduce your pain as quickly as possible so that you can go lead a more normal life without that painful shoulder.